everyone. So next video we are going to have a little look at cardiovascular disease in a bit more detail. So you should have already watched the video on non-communicable disease, which is already uploaded. You need to know a little bit more about cardiovascular disease than any of the other non-communicable diseases on there. So remember, a non-communicable disease is a disease that cannot be passed on from a person to another person. So basically, if you have cardiovascular disease, the main reason why you've got it will be something to do with your lifestyle, okay? Now, the factors that make you more likely of developing cardiovascular disease are called risk factors. And that doesn't mean if you do that, you'll necessarily definitely get the disease, but it means that you're much more likely to get it. So those can be things that you can't control. So age, the older somebody is, the more likely they are to get cardiovascular disease, or gender. And then there are things that you can control, which are your lifestyle choices. So things that you do that can be changed to prevent cardiovascular disease. Now, the major risk factor that we associate with it is smoking. Okay, now smoking can lead to a heart attack or a stroke, so that increases the likelihood of that happening a lot. So what actually happens, you've got nicotine in a cigarette. Now, nicotine is the addictive chemical in there, but it also is responsible for increasing heart rate. Now, if your heart rate increases, your blood pressure increases, and what that can lead to is because your blood pressure is higher, it can damage the walls of your arteries. Now, if the walls of your arteries are damaged, that means that there can be a build-up of fatty deposits on the artery wall. So if we have a little look here, you can see there is a normal artery and blood will be able to flow through that. And then this one is a damaged artery with fatty build-ups. Now, those fatty deposits are made of cholesterol, which is a fatty substance in your body. Now, you do need cholesterol. It's used for making your cell membranes and other various jobs around the body, but if you have too much damage to your walls, that fatty cholesterol can start sticking to the walls of your arteries and it can stop blood flow. Now, that can happen around your body in various different places, but there is one particular artery where if it happens, you have a risk of dying. So you have your heart, and there is an artery that supplies your heart with its blood supply, which is known as the coronary artery, okay? Now, the coronary artery is the blood vessel that literally takes oxygenated blood to the heart. Now, remember, your heart is a muscle, and it's constantly pumping away throughout your entire life. So it has to have a very good supply of oxygen in order to do its job. If this happens to your coronary artery and your blood supply shuts off to the heart, you're going to have no blood supply to your heart, no oxygen, it can't contract, and that's you dead. So that is what a heart attack is. Obviously, if you deprive any of your other organs of blood, that's also bad. So anywhere fatty deposits are not good, okay? But the main artery that could cause the biggest issue is when they build up in the coronary artery, okay? So that is how smoking leads to a higher risk of heart disease, okay? Now, we also mentioned in the non-communicable diseases video that it is also down to other risk factors as well, okay? So we've got smoking, which we've just discussed, a diet which is high in fat. So the more fat you have in your diet, the more chance there is of those fatty deposits building up on your artery walls. Lack of exercise, so if you're not burning up and using that fat for energy to exercise, then it's just going to stay in various places around your body. So you're going to, if you exercise, there's a chance that you can get rid of it. And obesity as well, okay? Now, it's not usually, if somebody gets cardiovascular disease, it's not usually just down to one of those risk factors. Usually they will all interact with each other. So you'll have, somebody that has a diet high in fat, is obese and doesn't exercise. All of those factors together make someone a lot more at risk of developing heart disease, okay? Now, we've discussed the levels of the impact it can have on somebody at a personal level, But it's not just personal levels that non-communicable diseases can affect, it's also a very wide range as well. So if we just have a little look at a couple of these wider ranging effects, first of all, it can affect people on a local level, so a local area. So basically, if you have a non-communicable disease, it is a lot more expensive because there's resources that need to be used, things like hospitals, local area hospitals. People will be needing treatment, needing beds in there, so there will be a lot of pressure on local hospitals and local resources, and also costly as well. Okay, so that's just locally based. But then if you think about that on a bigger scale, nationally, think about our National Health Service, our NHS, it's very costly to treat and also use the resources on a bigger scale as well, so not just in a local area, but on a countrywide scale. If a lot of people have these non-communicable diseases, or they've got the cardiovascular disease, there's going to be a lot of money and a lot of resources used on making them better. Also, not just on a countrywide basis, but also on a globally wide basis, non-communicable diseases are very, very common. And think about, places like America. The obesity levels in America are very, very high. And basically, if we looked at heart disease, it is the #1 cause of death worldwide. So if, it's not just for the individual, it's generally around the world. And again, if that's the #1 cause, we are using resources, we are using time, we are using money on trying to cure those people. Not just cardiovascular disease, developing countries as well, they are really struggling with deficiency diseases because unfortunately they don't have the resources and the money to pay for food that's got that nutrition. So basically, non-communicable diseases are actually preventing those developing countries from progressing any further in becoming developing, because they can't progress beyond that because they just can't afford it. Okay, so that is how non-communicable diseases are having a wider effect, not just on the person, but on the world itself. Okay, now going back to cardiovascular diseases, you need to know about how this can be treated. Now, the first thing a doctor or a health specialist would look at would be telling the person to make lifestyle changes. So it would be changing their diet to have less fat or less sugar, or it would be exercising to burn off that excess fat and use it as energy. Okay, if they are too far and they are already have a really severe build-up and damage to the artery walls, the doctor might think about prescribing them drugs. Okay, so you can see on there an example of a drug that could be prescribed are statins. Now what they do is they lower cholesterol. Okay, and if they do that, it's going to slow down that build-up of the fatty deposits in the arteries. However, negatively, it can cause damage to your liver, and it can also make your muscles ache as well if you're taking these statins. So downsides with those as well. We also have antihypertensives, which lower your blood pressure. Again, the lower the blood pressure, the less damage to the artery walls. However, that can lead to headaches and fainting. If you have a low blood pressure, you tend to feel a bit dizzy and a bit lightheaded. So it depends how severe that is. And we also have anticoagulants, which are drugs that basically make blood clotting less likely. So they're thinning your blood. And an example you may have heard of those is warfarin. Now they are good because they are going to keep the blood, if it's going to prevent people having blood clots. If there's less blood clots, there's less blocked arteries. However, if somebody gets a wound and they start bleeding, there could be excessive bleeding because the blood's not clotting to seal up that wound. So there are side effects with those. Okay. If they are not successful and the damage is too far gone and somebody is really at risk of heart disease, they can get surgical treatments. And again, there's 3 of them that you need to know about. So the first is a stent. Now a stent, you can just see there, is a mesh tube that is inserted into an artery. And when that gets inserted, it then widens and it keeps the artery nice and wide, so it stops it from narrowing in because of those damaged walls. So basically more blood is going to flow through there. However, these don't necessarily mean that they are a permanent long-term solution. They can actually narrow again over time, so the artery can just become narrower again. And the stent itself can actually cause irritation to the wall of the artery, which can again damage it, causing a build-up. So that is an issue, and it can lead to clotting as well. Okay. The second is coronary bypass surgery. Now that is, I think I mentioned it in the last video, is when you take a blood vessel from somewhere else in the body and you basically tie off the blocked one. So there's the fatty block there. Instead of the blood flowing off there, it will be sealed off and it will be diverted along a new blood vessel that's been taken from elsewhere. So that is a coronary bypass surgery. You are bypassing, going around the vessel where the blood clot is, so you're diverting away from that. And then finally is a donor heart, so a heart transplant. So that is physically getting somebody else's heart and then replacing your own heart with it. Now, as with any transplant, there is an issue. The donor heart might not always work, so it might not pump blood. It's very hard to connect an organ back up again, and also that person is going to have to take drugs for the rest of their life to stop rejection. So they are actually going to suppress their immune system, lower their immune system to try and keep it from attacking the new heart, which again, if they have a weakened immune system, it can make them a lot more susceptible to disease. Of course, all of those ones that we've just looked at, all of them are surgical procedures and they involve major surgery, so they are risky. So basically, we need to appreciate that they come with a risk of bleeding, infection and clots. So those would be the last kind of resort. If somebody had cardiovascular disease, they would try other things first of all. Okay, so that is us for cardiovascular disease.